Dr. Carlos Anciano, who is an associate professor, chief division of thoracic and foregut surgery and Department of Cardiovascular Sciences at ECU Health in the Brody School of Medicine. That's good to see you. How are you?
Good.
We had
well,
you here.
you.
We had you here years ago, and you had just started that surgery to help people with reflux.
Yeah. We were here about.
You were like one of the first guys in the country to do that, weren't you?
Yeah. We worked on the study when it got FDA approved back when I was in Pittsburgh, and when we pushed a little bit, and the guys at the hospital helped us bring it in, and that was about 4 or 5 years ago. We're probably a good 300 or so, or maybe more people that have received it since, and it's going well.
You got a long title now, Associate Professor, Chief Division of Thoracic and Foregut Surgery, Department of Cardiovascular Sciences, ECU Health, Brody School of Medicine. You know, we've talked about your background before, but tell us about yourself and your work at ECU and ECU Health.
We're down together now, and we've always really been, but it's now a little bit more official. I'm originally from Venezuela. I was born of a Spanish family in Venezuela, immigrants, and grew up there. Went to medical school there in Venezuela, and then things started getting a little crazy back home, and decided to go abroad to study with the idea to going back eventually, and so started in Canada doing college there, and then through there. Went back home, did medical school, worked for a little bit, and then came to train in surgery. And it's been a long road. You know, I was in Rochester, Minnesota for a while at the Mayo Clinic, and then from there went down to Mount Sinai and Morristown in New Jersey. And then from there, University of Pittsburgh. You almost kind of jump around when you're training. You go to different centers, and was at New York, Memorial Sloan Kettering for my cancer prep up there for a while, and then eventually came here.
Your reputation precedes you. Some of your friends are texting me, telling me how awesome you are right now, including one of our city councilmen, Brian Meyerhofer.
Brian's a good guy.
I hear your name quite often, and I know that you're very well respected. But it's interesting that you mentioned being from Venezuela and things getting crazy. Were you caught up during those Noriega years down there?
So Noriega was in Panama so I was during the during that whole process when the United States went in. We were there, and we were splashed, if you will, by the impressions of a country so close, starting to get in that. And those were a start a little bit of the years when all the if you will, cocaine cowboys and all, it started coming out. And so it was quite an explosion. It was very close around the time of the major cartel years in Colombia, which is right next to us. And now Venezuela is sort of in that group, And
so you were escaping that, wanted to be a surgeon, and you were able to come to, you said Canada, and then
so I went around Canada, Northeast, and then around the Northeast, and then ended up here.
So how'd you end up at in Greenville?
Well, there you go. It's an interesting story. Dr. Rand Chitwood was here, and he had the Heart Center, the East Carolina Heart Institute going, and they were looking, when you work on cardiac surgery, you attract also the other processes in the chest, the thoracic. What I do, we call it thoracic surgery. It just refers to all the other stuff besides the heart that it's in the chest. And so that's sort of when you train in both, in hearts and lungs and esophagus and all that area, but sort of you have your own taste and you go that way. And where I was training in Pittsburgh, it's a place where it's particularly savvy, your taste, of your training in these other areas. And so the team here, we're looking to expand a little bit on that. The esophageal adenocarcinoma is the fastest growing, one of the fastest growing malignancies in the United States. So everybody was kind of like getting ready for that tidal wave that was coming. And that's what's had a little bit how we got recruited. It was almost like handshake to handshake, boss to boss.
When you hear the term thoracic surgery a lot, what exactly, you mentioned cardiovascular, the rest of the chest. What else does it encompass?
So, people think of when you say a CT surgeon, cardiac surgeon, they think of the heart particularly, and we train in both. But you have the lungs in there, you have the esophagus, the food pipe where you swallow with. There's a bunch of organs we call the mediastinum. It's that little box between your breastbone and your spine and between your lungs, and it holds a lot of organs and glands in there that give issues. And to get this training, you also go through all the general surgery training. So we do a lot of the cancer diseases of the chest, lung cancer, esophageal cancer, proximal gastric cancers, and we also deal with the non-cancerous diseases there.
So you deal not only you deal with all that and the heart.
So when we start, yeah, things have gotten so specialized that it's very common for people to track both their training and your practices. You come out saying you're always that gung-ho when you come out. I do everything, send me everything. And then somehow life takes you into what you become good at and what you have a taste for. And before you know it, you blink and suddenly you've carved this little, we call them niches, where you're sort of attracting certain practices. You don't realize that you're good at it. And it's almost a learn on the go that you're good for that particular specialty.
If you're just joining us, this is a Dr. Carlos Ancinao, one of our stars here in Greenville in the medical world at ECU Health and the Brody School of Medicine. I've known Carlos for a long time, and everything I hear about you, people just rave about you and know that you're a terrific surgeon. The term foregut, what is that?
So when you're developing in utero, when we're small and we start growing, we're like a tube. And that tube, we call it the gut tube. And what parts come from the front, from the middle, and from the hind of it, we call them foregut, midgut, and hindgut. So it's a medical term. And so lungs and esophagus, our stomachs, they all come from the foregut portion of it. So it's a way to define that you work on those areas.
So let's talk about somebody who thinks they have some issues and they're seeing their primary care doctor. What are some of the signals that you might look for to make your primary care doctor aware that you may be developing some of the problems that end up on your table?
So it's a good question, and there's so many. It's such a vast array, but I would say that based on our areas, we live in the tobacco belt of the country. Lung cancer, it's a very, very important part of what we do. And whenever you have someone that's coming to you with fatigue, fatigue that you can't explain, weight loss that you can't explain, whenever somebody's coughing blood-tinged sputum, or they feel that they're coughing regularly, it's usually signs that we should entertain a little bit of a further workup. We have the lung cancer screening now is active in all of the country, in North Carolina and in the world for that matter. And so we are trying to get that to penetrate into the community when to start lung cancer screening on patients, because it helps you pick up the cancers a lot earlier. And and lung cancer, not all cancers are that, but lung cancer is one of those when a chance to cut is a chance to cure. And if you catch things early, you can certainly impact. So that's one of the things that we try to discuss with our community guys.
And I know you're a surgeon, but are there less invasive options? Do you look first for more therapeutic options before you consider surgery?
Definitely. When we're looking at cancer, we're trying always, I tell the patients, whenever lung cancer is so common, for example, that when you talk to someone, statistically, they are going to have one or two people in their neighborhood that has had or been touched by lung cancer. So they always come with a story. Hey, I heard, or with this conceptions of what you've seen lung cancer, or my family, or my brother, or my cousin, or my friend. And so a lot of the first part is really telling them and getting the communication that every story can teach you, but you are your own story. And so I try to define it. Lung cancer, the books are this big. They're encyclopedia size books, and the internet. Dr. Google, Dr. Yahoo makes patients go crazy. So when
Dr.
they come,
Google.
the first thing to do is to try and help them organize themselves. So we try to tell them, the first thing is naming it. Figuring out what you have, what family, what type. The next thing is staging it. And staging gets people nervous because they see all the old movies and I'm a stage 4 and all that. And, and nowadays, stage refers pretty much, the way to think about it is to where the cancer is. Is it only local in one area, or has it gone places? Because that defines then, when you know what it is and where it is, how you're going to treat it. And there's therapies that are local therapies. You can, for lack of, to make it simple, you can cut it out, you can cook it out, you can melt it away. with both chemistry, what a chemotherapy, immune therapy are. Well, nowadays we can stimulate our immune system to attack the cancers themselves. The last 10, 15 years in cancer treatment have been an explosion.
Yeah.
And so it's not always cut it out. It's about knowing which therapy is the right one to hit, because what it is true and remains true in cancer treatment is that the first time you go to bat to treat these things is usually the best time that you have. And when you miss out on the first time, it's a little harder to sort of keep things in the box, if you will.
All right, give us some lifestyle tips. Give us some tips on staying off your table.
Oh man, let me hide my belly below the table so you can't see it.
Oh man, you look like you could run a marathon right now. Don't start that. So I know you're going to talk about diet and smoking and all those things, but what are some lifestyle tips that you would offer this morning? Because if we have to get on your table, thank God you're there and you're the guy, because I'd want you to be the guy. But I don't want to go there if I don't have to. So tell me how to stay off of it.
Yeah. So it's a good question. I would tell you, obviously, like you said, you touch the basics. You touch of maintaining a diet. When we say diet, people tend to gravitate towards very restrictive ideas, or again, Dr. Google takes in, and then you start reading all this, I'm just going to take one sip of this and 3 of that. And really, when we talk about diets, we try to talk about moderation and balance, about, having an intake of all food groups when you can, of maybe not doing seconds. I tell my patients, be the first one to sit at the table, be the last one to get up from the table, be the smallest plate at the table. So eat small, eat slow. Activity is very important. You don't need to go out and be running every day or pushing, for a training, but definitely would recommend half an hour to 45 minutes of activity every day. Activity can be anything from washing your clothes to getting out and walking around. Whenever we're going to operate on someone, we put them on a walking plan. We ask them, you're going to walk 2 mailboxes today, you're going to walk 2.5 mailboxes the next day, you're going to walk 3 mailboxes the last day. By the time they get to surgery, they're walking a mile a day, and that changes immediately the impact of how you do with surgery. So it's really about activity, and obviously I'm a big pusher for stop smoking. We do not, me or any myself or any of my 3 partners, Dr. Anitoni, Dr. Spiker, and Dr. Oliver, we do not operate for lung cancer on anybody that's smoking currently. It increases the problems while you are doing the surgery. That's why we push for that. But also, you need to create an impact on what are we doing if we're not stopping the culprit of where we're operating on.
So ECU Health has become quite distinguished in this area. I know you're a big reason for it, but why? I mean, if you can be objective about that, why has ECU Health become one of the leaders in the Southeast for this kind of surgery?
I think that location. Like they say, we're in a position where we funnel such a vast territory in the East that was and has been for years. Requiring healthcare of every level, and despite the mission for ECU being a mission of a primary care medicine, of attacking the basics of what healthcare is in our communities, which is a beautiful approach to how to start. They've done such a good job at what they do that you start attracting all sorts of disease processes and realizing that it's not just the primary healthcare that you attract. And so all this helps pick up on surgical processes, surgical diseases that need surgical attention. And so it attracts the need for surgical specialties. And that's how we have sort of exploded, if you will, in the last 20 years as a site to go to for these interventions. And the fact that, we are a major tertiary center, quaternary center, if you will, in an area that lacks them, it's important for our patients.
Well, we're proud of it. And, I look at what's happened in the medical community here since I've been alive, and it's pretty amazing. How about the pandemic? How has that changed what you're doing?
Whoa. Yeah, it changes, just like it changed what you're doing. It hit us at a human level for all of us. It's when we started, when things started coming down, there was so little information about what was coming that we almost have to organize ourselves and in the hospital amongst physicians that were particularly exposed to airway processes. We're all exposed as people to the pandemic, but when you're working, breathing right inside of the patient, they're coughing in front of you, or you're dealing with that area, the respiratory area, like our infectious disease, our intensivists, our critical care docs, the surgeons, the interventional radiologists, and all the people I'm living out. Everybody was really exposed in there. We all sort of got together, and we try to extrapolate how things have been tackled in different countries, not just with the pandemic, but with other similar viruses and respiratory viruses in the past, and we sort of put protocols together that helped us to get through. But that was in the beginning, and now that we've sort of gone couple years with this and a little more now, and we've sort of understand how the virus works and how it works, we've sort of created protocols that we're now navigating as normal, our new normal, if you will. And the testing, the how we wait before we operate on someone, the how we treat them, how we warn them of not having the virus after you operate. It's particularly worse whenever you have an active process. We recognize now that it's not just the virus, but how the body responds to it, how some people can do this more aggressive reaction. And so we warn our patients about it, but it changed how we practice now. Now it takes longer to get a patient through the workups, because everywhere they go, they have to be tested for it, appropriately so. But so it creates a little bit of havoc, you will, in scheduling and all that. And it has created also an influx, outflux of personnel, staff in the hospitals, moving around, people not necessarily willing to be exposed to the virus more, or they consider that a value asset, so they will go places. So it becomes almost like a market commodity that you're willing to work with that. So it has changed at everywhere, economic level and everything.
So what resources are available for patients that want to learn more about thoracic and foregut surgery? I mean, where do we go to learn more?
Yeah, so they can go to our web pages, to contact us, and they can look at our names or through cardiothoracic.
So if they want to look for you specifically, it's Ancinao, right? Anciano.
Yes, or they can simply look thoracic surgery at the pages in the hospital, and they get the contacts. If they wish to call us, the 252-744-4400 number is a good number. And at this point, in this area, Dr. Carlos will get you.
Dr. Carlos. Everybody knows Dr. Carlos.
If you
listen,
say that in the hospital.
It's great to have you back in here. It's good to see you.